Good morning, everyone. A warm welcome. You're all starting to come in now. We're due to start in a few minutes, but we thought it would be great to have you all come in at this moment in time, and then I can say a few things before we get going at 9:30. So one of the things that I thought we'd do first of all is, as you're coming in, you'll be able to see the screen with a holding slide just now. I'm just going to move it on to the first slide just so that you can see for everyone as they're coming in what the actual session is, to make sure you're in the right one. What would be wonderful is there's two boxes, one which is called conversations and the other one is a questions box. What would be great to do is in the conversations box at the top, so that's at the top left, if you wouldn't mind just typing in your kind of name, where you're based at the moment, so location and kind of career stage if you can. So just to let me know a little bit about who's in the room. The format itself that we'll do, we'll get a sense of that once we get to 9:30, but it'd just be great to just get a sense of who you are. Hello, Mohammed, F2IMG. Hello, Mayor, how are you? That's great. Thanks so much. So that's really good to just get a sense of where people are. Wonderful. Thank you. That's wonderful. Thank you, Vandana, GP. That's great. So the reason that I'm asking this is that one of the things that's really helpful to do with interviewing is just to get a sense of where people are in their own career stages. And also it has a difference, and an impact on that. So morning, everyone. As you're coming into the room now, warm welcome. One of the things that I just wanted to get everyone to just do just now was just location, level a bit, just where you're based. So just as we're coming into the room, we're due to start, in just under a minute, but it's just wonderful to just have that whole, oh my goodness, that's really exciting for Sarah. She's got an interview in a few hours. Sarah, we're going to send you positive energy. Do you know already the format for your interview? Are you doing it virtually? If you don't mind letting us know, Sarah, how it's working, that would be great. So I've been seeing a lot of things working. Yeah, thank you, Olivia, for sending good vibes to Sarah. That's really thoughtful. So we've got dentistry, and we've got Knut from Turkey. This is brilliant. Thank you, everyone. Oh, that's really nice, Helen, to wish Sarah good luck as well. And so we've got a mix of people from all around the UK, different levels, and then also lots of people from all around the world, which is fantastic. And so what you'll see is that there's two sort of function areas. There's the conversation area that you're all putting in now, which is brilliant. And then there's also a question box, which is underneath. And one of the things that I thought we do, really, it doesn't matter too much if you put something in the conversation or in the question box. But what I was going to say was, if you do have any questions, don't hesitate to put them in there. What you'll find I'll do as we run the session is I will kind of group questions, because I'll see a few things coming through. So that will be what I'll try to do. And if I can, I'll weave anything in as we go. But a warm welcome to the session on interview skills. My name is Susie Edwards, and I'm going to be taking you through this. Our scheduled time is from now, and we're due to finish at 10 o'clock. So what I was hoping to do is to run through some key things in relation to the interview and thinking about the kind of preparation and what you need to do there. And I'll highlight what I'm going to cover in a moment. Just to get us going, really, one of the things just to say is this is just me. This is my background. I've been working in this area for about 15 years. I'm really curious about understanding about what leads people into the different medical pathways of what they do and how your career evolves through time. And I coach and train in NHS trusts. I write material on this topic, and I have other areas of interest that I do as well. So what I wanted to try and make sure that I covered, first of all, and thank you already for putting in some questions so far. I'll look at those as we go. There was 3 key areas that I felt today that I'd really like to focus on. And when we're looking at these 3 areas, you'll see on the screen here, the first area that I want to really look at is the preparation for the interview. So in terms of the flow of what we're going to do, really trying to understand a bit more around that, what we want to do, the preparation for me is fundamental. And then thinking a little bit more around what is actually being assessed. And so one of the things I'm going to do in a moment is we're going to launch a poll. Our first poll is going to be launched. And what that will do is it just gives me a sense, just with everyone who's coming into the room now, a little bit about career stage of where you are. So we're going to launch that poll. And what you'll then see is just a number of questions. So it'll be foundation doctor, junior doctor, just because as we came in, there's different people just coming into the room now, so that we can get a real sense of how many people. It's just helpful for me just to kind of know where everyone's at. That's great. So keep sharing it on the conversation, and then also we've got it coming up on the screen. So I'm just getting a sense now. So yeah, brilliant. Thank you. So it's really helpful for me to get an understanding of the stage, just because it enables me to, right, brilliant. So I'm starting to see, in terms of you answering now, I'll just hold on as we go. And then the third area that I thought we'd cover is thinking about the different types of questions that could be asked, and then some techniques for framing them, just so that you've got a few things that you can do beyond today to really help you with that. So what's wonderful, I can see now kind of roughly on the poll at the moment, I'm just having a look. So I know that there's quite a mix of you who are other, and I can see that you're writing in a little bit about background. So it may well be that you're in other healthcare profession. What would be great for those of you that have written in the other, would you mind just sharing a little bit more around where, you know, what your experience is, just in the conversation box, just so that I can get that. So we've got junior doctor, we've got a nice mix of junior doctor, and we've got foundation, brilliant. So that makes sense because of the time of year. We've got final year medical students, which is lovely. Thank you so much for sharing, brilliant. And then I've got a sense of people going into different years, international medical graduates, locum consultant, brilliant. Thank you, everyone. What I'm now going to just do is, there's just two parts to this. There's another poll that we're going to launch. The reason that I want this is I want to just know, a bit like Sarah, who's got our interview today, but actually to understand when you've got an interview coming up or not, just to get a sense of it. So there's another poll that will just be launched in a moment, which is just asking, when is your interview? Have you got one happening now? Is it kind of a month away, or no interview just yet, but you're just really interested in this topic area? It's just a good sense for me just to help. That's fab. Brilliant. So that's really helpful to know. So some of you have got one that's happening quite soon. Great. I can start to see it all coming up on the screen now. Thanks everyone for doing that. That's great. No, that's great. Thank you for letting me know. So no interview yet. Yeah. So on maternity leave. Thanks, Louise. So what I'm getting a set. Yeah. But one of the things that's great is that, you know, if you have got an interview coming up now, then it's really good preparation for right now. But also, one of the things that you can do after today is access this again. So what you can do is, when it's closer to the time, you can then think about what you want to do. So that's brilliant. So one of the first things that I thought we would do is really think about the preparation for the interview itself. And I think for me, that's quite key for us to focus on first. And what I would say is that for all of you, you know, in thinking about the preparation for the interview is, you know, if you're at that stage where you're doing that and you're thinking about preparation, then well done, because you've already come through a number of hurdles to get to this point. But before you actually get to the interview itself, there are loads of things that you can do ahead of the day to give yourself the best chance of securing the post. And depending on the level that you are, there are going to be some specifics that you really do want to familiarize yourself with. And that was why I was asking just about the range of the audience in the room today, because we've got some people who are foundation and junior stage moving through, and then we have people who are post CCT, you know, and also just understanding about how they navigate through at that stage. But irrespective of level, I think there's a number of things, you know, as you move through your career, where you've got an opportunity to understand about the hospital and trust and practice. You know, what will the interview be like? You know, will it be competency based? I'll explain a bit more about that as we go. You know, historically in the past, interviews would be in person, and also interviews would have a number of stations and activities, and there might well be role play. And for those of you who are an earlier stage in your career, so people who are in foundation going into their specialty early stage years, or those who are at junior doctor stage running through, one of the things that you may well already have noticed is that when you go on to a number of the sites for moving into specialty, that there's going to be announcements this month about the actual flow of how the interview will take place. What I want to do is just cover a number of the things that, you know, could come up. But the key thing really to think about is, you know, actually, in terms of the interview itself, what can I do to really prepare myself? So just for a moment, just to separate from kind of more junior years to senior, depending on your seniority, so I'm thinking more about the people who are a little bit further on in their career just for a moment, there are key things that you definitely want to do, which is to understand the team structure, reporting lines, have a clear understanding of the role and what you'll be going into to specifically accomplish. Last week, I was working with someone who was doing a Zoom interview for a consultant post. And one of the things that they spent quite a bit of time on, which was very beneficial, was, and this is for senior level, was pre-interview preparation. So it was so useful for them to understand the role, which was newly formed, and then being able to get a sense of actually how things would work in terms of the actual dynamics of the team, so that when they went for their actual interview, they had a lot more confidence around the questions that they'd want to ask, and that behind the scenes preparation really helped them ahead of the day. So this is more for senior level roles. So just to sort of let you know, as I go through, I want to bring in different aspects. But for those of you who are going through the interview process, where you may well access Oriel to do a number of those, which are those going through, you know, as you're going through for foundation to junior doctor and so forth, you'll be accessing Oriel to do the training program. So what I thought we'd do is think about, I'm just having a look at some of the questions that are coming in as well. And so, yeah, I'm seeing that people are asking a little bit about, yeah, brilliant. So there's people are asking about scenarios that could be asked to interview. What I'm going to do, Idris, with that is there's a number of different scenarios that could well be asked. And I'm going to bring up something in the slide next, actually, that starts to look at methods of assessment. And Raj is asking a little bit about leadership and management and the kind of questions that could be asked. So what we'll do as we go through is I have some things on that, which is great. And so the key thing I would say to you is that if you're going for a particular role, you know, where you're going into, if it's specialty years, for example, and you're going into, say, surgery, or you're going into IMT, or it's psychiatry, whatever it is, what I would say to you is that at the moment, one of the key things to do would be to make sure that you have access and you're looking regularly to the recruitment sites for updates on how the recruitment timeline will work and actually how the process will work for your ST1. And what I'm going to do is I'm going to provide you with some of the assessment processes that could take place and actually what you might do and the kinds of questions that could be asked. Obviously, the caveat here is they're general here, but I want to give you that understanding of the different types of things that could be there, so that at least you've got a really good idea of what's ahead. So what you'll see here in terms of the actual the screen here, I've got a number of different methods on here. Now these are based on a whole different ranges of levels as well. So on the whole, and for the majority of you, a competency-based interview is where, just to be clear, just in case some of you just want to be absolutely sure on that, is where there are a series of questions that are looking at some fundamental skills that you've gained, whether they be clinical or non-clinical. So what you'll be doing there is asking questions around thinking about communication skills. Thank you, Shazma's put something up there. Absolutely. So what you can see in the conversation is Shazma's using a technique, and we'll share this later, actually, called STAR. And it's wonderful to actually apply for certain types of questions. So thank you so much for doing that. So there's the competency-based questions, which are looking at, you know, problem solving, organization, those types of things, the leadership ones. And then usually there is always something that's looking at your motivation to actually work. And so the motivation to actually work within the role and thinking about your values. So we'll cover in a little bit of detail, a bit more around this. And then you can see that for some of you, depending on your stage, you may well be going through an SJT and MSRA in order for you to go through to the actual next stage of interview. So there's lots of different methods that could be used to assess. One of the things that Raj has just said was using a technique called SBAR. And so that's a situation background. I'm just trying to think about the SBAR. You tend to find historically SBAR being used in acute settings. It's extremely useful when you're talking to a colleague where you're really thinking about passing concise information across clinically about an individual situation. So the SBAR is very useful to communicate with colleagues. And for some of you that might do that, as you're saying for Sanjoy, for handover referral, it's extremely useful. I think the technique that one of your colleagues was sharing, the STAR, is slightly different for the interview, but I just wanted to let you know that. What I think is key, and I really think is that absolute first takeaway, Raj, don't apologize, it's great. Any thoughts are brilliant. So the research side, I think what's absolutely fundamental for no matter what stage you're in is all of you will have your person spec. So whatever stage you're going for, you'll have the person spec, you'll have the job description. So even though you've not got an interview coming up right now, you absolutely know that there are some key things that you need to be focused on. And what you'll be able to see within that is there's the essential and there's the desirable. And within that, the key thing to do, the thing that I absolutely encourage most people to really spend time on, and I just wanted to get your sense in the chat function. How much preparation do you think you would tend to do when you're preparing for a kind of interview? How much prep would you tend to do? In the chat function, just let me know. And I'm just going to move on to this one here now. So these are the possible assessments here. So you can see them up on the screen now. So you can get to see all of that. So we're seeing a number of people respond on that. So different days and things like that. Yeah. Brilliant. Thank you. That's great. So you can see here the different methods that we have. And then what I thought we'd look at in terms of research ahead of time is splitting it into 3 different areas. So we're getting a sense from different people, you know, the number of days. I mean, obviously, however much time you have is great, but it's helpful to really think about when you're looking at the job description and person spec, for you to really think about what are the 3 key messages that you want to get across about. For example, Ziba's mentioned, you know, I want to go into neurosurgery. You know, one of the key things really we'd be looking at is, you know, what's motivating you to apply to the specialty, and what have you done to confirm that this is right for you? Or talk me through, you know, your portfolio and highlight, you know, things around your active interest in that area. And I think, for example, for me, if you're able to map answers to the kind of examples. So for example, if there's a question looking at leadership and management, say, what kind of things have you done, whether it be something where it might be as straightforward as looking at the rota and helping organize that, where as you go through your career, it might well be more around looking at the kind of leadership and management of a team. It could well be further where you've actually been on, you know, significant projects that you've been working on, and it may well be related to your areas of interest. But the key thing is to think about, what evidence do I have for each example? So I think that for me, absolutely, what you need to do is really think about the different examples that you might want to highlight. And then the second part, if you've got the opportunity, and this kind of relates to people a little bit further as well in their career, where you're really thinking about the practice, the GP practice that you're going to work in, the trust that you're going to, like, understanding the developments in the department, the structure of the team, the expertise and interests of the team. And these are all the things that you can do beforehand. And then the actual next thing that we're kind of going to move on to is actually thinking about the actual interview and panel itself. So who will be on it, you know, understanding about the respective roles. The more senior you are, I think what you need to be thinking about is the benefit of the pre-interview contact that you have, and arranging to do that digitally beforehand. I think one of the other things is particular areas of commonality that you might well have, you know, things where you might complement. So if you're going into a GP practice and there's particular areas of interest that they have that you're also interested in, it makes a lot of sense to think about that common areas. Or if you've got areas that you want to develop special interest in, for example, it makes sense to do that too. And so the last point I've got on the screen is, what questions do you have for them? One of my favorite ones, just because it's my favorite one, doesn't mean that it's the right one, is, you know, if I was successful in the role, what would you hope I would have achieved within the first 6 months of joining? Or how, and obviously it depends on the stage that you're at. And the reason I really like that style of question is because it allows you to really think about what the actual panel say, and what thought they've given to the actual role, what they see as the priorities. So I think really for me, that's really helpful to kind of think about. And one of the things that one of your colleagues has mentioned, how to avoid thinking about stock answers. And I think Thurwa is also asking about mistakes. I think one of the things about mistakes is that, for example, the mistake that you've made, what they're really looking for is, what have you actually learned from that experience, and what will you do in the future as a result of thinking about that? So I think for me, one of the key things really is to make sure that you're really thinking about that side of things. So that's really important. And then in terms of who will be on the panel, it will be a mix based on your stage. So there'll obviously be a mixture of TPD. There'll be, potentially a chair. There'll be a consultant representative. There might well be HR. There could be a lay chair. There's a mix of people who will be on that panel, but you'll usually get to know a sense of that beforehand. And I think the purpose really of any interview, just to be absolutely clear on that, is there's three things that they're really looking for. So in terms of thinking about that, is there will always be questions on motivation. there'll always be something that looks at motivation. And if you think about it, usually one of the first questions are, talk me through your skills and experience, and and why they're suitable for the role. And it's a very open question, and it's very much around thinking about your motivation for that. And I think one of the things that Sanjoy is just asking here is around, things around change management, communication, teamwork. Yes is the answer if it's relevant for the role, Sanjoy, because they're all related to competencies. So it could be, tell me about a time when, or what does leadership mean to you in relation to your team? And, so in terms of change management, it might well be something around, talk me through a recent quality improvement project that you've worked on, looking at the kind of aim and the outcome of that. So things like that you can get a sense of. And Bash is asking a little bit around thinking about things relating to areas of weakness. And it would be interesting to get people's thoughts on looking at mistakes and weaknesses. So one of the things, and so you can get a sense in here. Wonderful, I'm getting a sense. Yeah, thank you for that now. So what you're looking at here, I'll bring a bit more on weaknesses in a moment, but what I'm looking at here is three things. Can you do the job? So do you have the knowledge, skills, and experience? Will you be able to kind of rise to the challenge of the kind of situations that you will face in the specialty? And then, do you have the appropriate strengths? Are there any areas where you've got gaps, and what would you do to try and plug those gaps? And then there's something around the passion and energy that you want to give to that. And I think that for the actual interview itself, in terms of what they're assessing, there's usually a number of different areas, and it's connecting in to a number of things of what people are saying. So obviously there's going to be some things on your clinical knowledge. And then for there, you've then got your non-clinical skills, your commitment, clinical communication, and communication will always be something that's incorporated into the interview because it's such a fundamental aspect of most of your roles. Now, one of the questions that Mayer's asked is they're just asking about, what do you do if you don't have leadership experience? Now, Mayer, I would say to you that you will have leadership experience, but I suppose sometimes when people are thinking about this, they're thinking about like a big L and a little L of leadership, and it doesn't necessarily need to be clinical leadership. So there might well have been things that you have done where you've taken the lead on a project, on some activity with a committee. You've done something that's completely out with, which is related to kind of voluntary experience. You will have something where you will have taken ownership, I'm sure of it, but it's just more about how you structure that. And we'll come to look at that, how you might structure those questions. I'm just going to move on to that in a moment now. But I think there's also usually a few other things to come together. So I'm bringing this up now. So in terms of what they're assessing and looking for, you can sort of see some of these areas here that I've just highlighted. So thinking about the clinical knowledge, all of those areas. So professionalism, one of the key things that I'd again recommend, so there's a number of takeaways. The preparation is really, really key. The second one is really thinking about, in terms of professionalism, looking at the GMC and the duties of a doctor. Andrew's mentioning something which actually is very salient to mention at this time. Usually what might happen is, what does leadership mean to you? And give me an example of how you've used that in practice. Within the NHS, collaborative leadership is something that's, really quite key for obvious reasons, because usually in order for you to do what you do, you're bringing people together. And in terms of thinking about what you mean by that, you can provide different examples. But when you have led on something, there may well be things where you've taken the lead, you've dealt with difficulty, and doing that there. Bash is asking a little bit about things around areas of weakness. Now, what I would say to you all is about areas of weakness. Sometimes people really do worry about this, but I think what this is really about is about thinking about how you really reflect. So thinking about the way that you reflect about what you've actually done and experienced. And I think one of the key things to really look at, so a good example of thinking about what you want to do is, for example, if you've actually had a situation where it didn't go in the way that you wanted to, what did you actually learn from that? And what do you do differently as a result of that today? So the key thing really is thinking about, what have you learned from that? And what do you do now as a result of that? So whatever the skill might be that you feel is an area of weakness. So one of the other things that's coming up is asking a little bit around managing conflict. Now, there's actually a lovely technique on managing conflict, which is a technique called CARP. I don't have that on the screen, but it's called control, acknowledge, refocus, and problem solve. And the structure of that is the idea of being kind of controlling the situation as much as you can, acknowledging the other person's feelings and using, rapport and your emotional intelligence to do that, but then actually thinking about how you refocus. So you can use a technique where you can flip the conversation to make sure that you're focusing in on the key parts. The key thing really with any conflict, as much as you can do, is to separate the emotion from the person, really. And so there is a structure for doing a technique by Robert Bacall, actually, which is called CARP. What you'll see on the screen is I've got different types of questions. And I think that rather than thinking about the absolute specific question that might be asked, I think it can be very helpful to think about the types of questions. So one of the things that can happen when you're applying through, this is more for sort of senior roles through NHS jobs, there are a number of competency questions that are in those, which are relating to teamwork, leadership, management of change, for example. And one of the things that you may well then expect is to have some questions that relate to that as well. So you've got the key things in here is really understanding, a range of different things around clinical procedures, thinking about NHS issues. For example, this week is NHS Values Week, and value-based questions are something that's really useful to understand. So looking at the values of the organisation and trust that you're going for, and just looking for synergy with yourself. I think the other one is around, potentially around thinking about scenarios or hypothetical settings. So I think, you often will see things which may well look at what you have seen other people doing. So looking at scenarios. So when you're on the job, just thinking about how did that person deal with that? How would I do that if that was me? So I think that when you're looking at different scenarios, it's really looking at your ethical dilemmas and looking at professionalism and how you would respond accordingly to that. And I've got a technique which I'm going to bring up in a moment just to show that. But just to go back to just the competencies, for example, please can you give me an example of when your communication skills have made a significant difference to patient care? Fundamentally, the topic area is communication. The question could be anything around that, but if you've already thought, I'm definitely going to get something on communication, I want to prepare one about, one to do with a patient, perhaps one to do with a colleague, and one to do with it being quite a complex situation where I had to explain something and make sure it was there. You start to build up those banks. This is all about confidence. And I think the other thing is about the behaviors, like when have you demonstrated this? Thinking about the stories, going back to what I said earlier, is really crucial. And then what I'm just seeing here, I'm going to come to a couple of questions. Yeah, this is great. So one of the next things that I thought, and this goes back to what one of your colleagues mentioned at the start, which was using the STAR technique, which is the bottom one here. So what I thought I would just do is just move on to this next slide, which is looking at some different techniques and interview and mnemonics to try and help. So not to overthink this, because the key thing really is it's all about the structure of how you reply to a question. So I think it's really important to think about that. So why have you applied for this role? So one of the things that you can do with structure is look at, I'd like to talk you through, my clinical, academic, management and personal experience. So the clinical might be experience to date, where you've worked and the skills gained. The academic could be, research area of interest, education, if you've had an opportunity to teach and share your expertise with others. Management, I'm not doing it exhaustive. It could be service development, quality improvement, you're kind of looking after the rota, you're supervising others. And then you've got your personal outside interests, community involvement, for example. Or you could have something that simply says, I think I mentioned this earlier, talk us through your skills and experience and their suitability for the role, or what's motivated you to apply for this specialty. And then dealing with difficult situations. So just to go back for that, the technique SPIES, which goes SPIES, is actually really helpful, where it's looking at seek info. So what is actually the problem? Always go back to patient safety. It's critical that this is taken into account. initiative. What can you do to solve the issue? And then highlight those steps, you know, so it's really helpful to have that. The discussion and conversation is amazing, everyone. Thank you so much for all that contribution that you're doing. And then the third area, which is something that many of you may well already know of, is situation, task, action, result. So what is the situation? What were you asked to do? What did you actually do? And what was the result, or if appropriate, reflection? Some of you might be asked to do a presentation and be asked to do something, you know, where you've got, you know, some preparation ahead of time. What we don't know at the moment, Deepa, it's absolutely brilliant for ethical scenarios. It's good in lots of different ways because of the structure. The structure gives you confidence to really help. I want to just have a look at, I've been trying my best to weave as many questions in as we go. And I just want to just double check on a couple of things in terms of looking at, so I'm just double checking on here, and I'm just going to scroll up as well. Prioritization questions, Helen. Do you know what? The prioritization questions, one of the things is about justification of how you've prioritized it. So when you're looking at, you know, the rationale for what you've done and in what way. So I think the key thing really there is that there will always be something that should be done first, and there's usually something that probably should be done last. And then in the middle part is about the rationale for doing it, but it will be based on the context of the question. So I highlight underline, if you can, have a look at underlining before you prepare for that. But the key thing is that an interview is as much, it's as much of you to understand about the role as for them to kind of get a sense of you as well. And so people have got, so someone's particularly asking about the CARP, which is CARP, which is control, acknowledge, refocus, and problem solve. So Amar, if you Google CARP, and if you Google Robert, I think Bacal, BACAL, I think it will come up there. But also the SPIES works really well for that, because you're also doing it in that way. It works for any negotiation, conflict, anything also around assertiveness. So it's all of that put together. Now we're almost coming to the end of the session, and I'm just seeing some resources to suggest, you know, so things to look at. So I think that one of the key things to do, if you haven't already, is the BMJ have a really fantastic piece of e-learning on interview skills, and it's based on different levels. As a next step, you're obviously going to have this available, but I think also using something that you can do at your own pace is really advantageous to do as well. Definitely look at the GMC. They've got really good kind of ethical dilemma questions where they provide you with the answers. You also need to look at the duties of a doctor, no matter what you're doing. So all of those things are fantastic to do. Oh, thank you, Haydar. That's wonderful. So there's loads of good stuff on it, and so lots of things. So we're just about coming to the end of the session now. I really wanted to thank you so much. We've tried to pack in quite a lot in a short period of time, so it's wonderful to have you all here. And good luck to Sarah, who's got her interview in a few hours. Good luck, Sarah, and good luck to everyone else with whatever you're doing. And take care and enjoy the rest of your day. Thanks so much, everyone. Take care. Bye. Thank you so much. Take care. Oh, thanks for all the thanks. Bless you. Thank you. Keep well, everyone. Thanks so much for all your energy and enthusiasm.